Drug and alcohol abuse. Unfortunately, it's quite common for people struggling with their mental health to turn to drugs and alcohol to help, to take away the feelings that they're feeling or that they're experiencing. Conversely, it's quite common for people with drug and alcohol addictions to then go on and develop mental health. So the two seem to go side by side. If you think somebody has a drug or alcohol problem and you want to talk to them about it, don't do it when they are under the influence, because it's not the right time and they will not remember it. If you are looking after somebody who is seriously under the influence, it's really important that you look after their welfare. Now, alcohol reduces your inhibitions hugely, as do drugs, and they make it more likely that you will undertake risky behaviour and maybe get yourself in a difficult situation. Likewise, if you've drunk too much or overdone the drugs too much, you could end up being unconscious. So you're then talking about a physical first aid emergency. So if they are unconscious and they are breathing, it's really important you put them into the recovery position so that the contents of their stomach will drain out and their tongue will flop forward and they're not in danger of choking on vomit and their airway blocking. So their airway is a priority. If they're unconscious and not breathing, you would resuscitate them. If they're seriously under the influence but they're not unconscious, it's their safety that is most important, and the safety of those around them as well. Sometimes they can get quite aggressive and a bit belligerent and be more prone to getting into fights as well. So really important that you're looking after their welfare. The other important factor to understand is that alcohol makes it harder for your body to control the temperature or their body temperature. So if they had collapsed and they were outside, it's possible that they could end up with hypothermia. Now, hypothermia in its own right can be very serious, so their body temperature can drop. So it's important that you keep them warm and that you bring them in if you possibly can. Bring them in from the cold. But the other thing about hypothermia is that A, it can make your heart a little unstable, make you more prone to a heart attack, but B, it can also affect the way your blood clots. So if you've got a serious injury, it can make it harder to stop it bleeding. The other thing about drugs and alcohol is if they have hit their head and have a head injury, they should always be assessed by a health professional, because it's far harder to look for signs of the normal things you would look out for following a head injury if somebody is already intoxicated. So those are the key things to look after in order to manage somebody's safety, and then you would move on when they were sober or not intoxicated, and have the sort of conversations that would be able to help them and signpost them where they can get some help.